supertalk.fm. We're also streaming from that SuperTalk Mississippi app and your local SuperTalk Mississippi radio station. And don't forget, you can watch us too. We're on your computer, your mobile device. Just head on over to SuperTalk TV. Now, February is both Low Vision Awareness Month and Macular Degeneration Awareness Month. I knew I was going to have a hard time with that. And Dr. Lott is joining us from Bellevue Specialty Eye Care. They are the only optometry clinic that specializes in pediatric vision therapy in Hattiesburg and the Jackson area. So welcome, Dr. Lott.
Thank you so much for having me today, Rebecca.
Macular Degeneration Awareness. I had to recoup myself. Did I do it better that time?
You did it better. We can even make it much easier. And in the medical community, we call it AMD.
Oh, I like that.
We abbreviate it because it is a tongue twister.
It is a tongue twister. Okay, so February must be at least a busy a month for you guys to get out and raise this kind of awareness. But I want to start with low vision awareness because I feel like AMDA is typically, you think of maybe your more wise in years individuals. But low vision awareness, I think, could happen at any time. You can correct me if I'm wrong, but kind of what is this idea of awareness for low vision?
Absolutely. So a lot of times whenever patients get a diagnosis of any kind of ocular disease, they just feel like there's no hope. You know, they'll hear a lot of times, you know, from us as eye care professionals, we may even say, well, there's nothing more I can do for, you know, your eye condition. But what we fail to follow that up with so many times is, however, there's still hope for you and your eyesight. And so although there's nothing more that can be done to the eye, oftentimes in some of these ocular diseases, there's almost always something that can be done for our patients to have them continue their independence and their quality of life. The reason the macular degeneration and low vision month, I think, go hand in hand so well is in our practice, probably 80% of our patients actually come in with a diagnosis of macular degeneration. So we do see patients of all ages and all different types of diseases. However, macular degeneration is by far the number one thing that we see in our practice when it comes to low vision.
So when you think about AMDA, I'm not even going to try it again, Dr. Lott.
That's okay.
You know what? I scored it once today. I was just going to run with that one. You gave me an easier out. At what age, am I right that usually happens later in life? So at what age do you think some patients start to recognize the lower vision and they just blow it off, or maybe they don't realize that their vision is slowly getting worse? They're just sort of chalking it up to, you know, a million other things that you can. And if they came in sooner, does that help with the progression of the disease?
Yeah, all of those. So those are all really great questions. So I'm going to give you a fact. I don't love a bunch of facts and numbers, but this one's probably going to blow your mind because we don't think of 50 as being old at all. Like, to me, 50, like, I mean,
I'm really close to it, so no.
You're young, exactly. It's not old. 1 in 14 people age 50 and older have macular degeneration. That's a pretty high statistic. Now, there are things that put you at a higher risk. Genetics, of course, if you're a smoker, Caucasians, women. So there are certain things that put you in a higher risk factor for macular degeneration, and there are things that we can do to prevent it and slow it down. Some of those are, like any kind of disease, our health. You know, don't smoke, make sure you're taking good vitamins, eating healthy, all the colors of the rainbow. You know, those type things are very important for macular degeneration, but really it's knowing the signs of it. And so macular degeneration affects the central vision, a person's very central vision. So they might notice that fine details, faces, reading just starts to get a little bit more difficult than it used to. Whenever they look directly at something, there's just a blur or even wavy lines in the middle of their vision. And again, if you can treat it early, like almost all health conditions, your rate of success is just going to be better.
Is one way to do that, Dr. Lott, is have an established relationship with an eye care professional that's checking you? Is it annually? Is it every other year? What are the recommendations in terms of going to see your eye doctor to get ahead of these things if they were to pop up?
Yeah, so actually the recommendation at this stage is at once a year. Once you are diagnosed with macular degeneration, that may change. It might be every 6 months. It might be every 2 months, depending on what your treatment plan is with your provider. You can have what we call dry macular degeneration, which it's more of a monitor, and then you can have a wet macular degeneration, which the treatments for those are more lasers, injections, things like that. There are new treatments coming out now for dry macular degeneration with the injections and all, but that really just that's between you and your provider on how aggressive and how advanced your disease is.
So, Dr. Lott,
at least once a year.
What I'm hearing you say is if you've been given the diagnosis of AMDA, don't run from it. There are things that can help. If you haven't and you're aging, then you just need to go ahead and establish that relationship so you can catch it in the forefront or prevent it altogether. Those are the two best things to do. But just hiding in the sand about it is not the best solution to any of the problems.
No, it's not. And, a lot of the patients that we see, they are finally retired. They're ready to travel. They're really ready to just enjoy life, go to grandkids' ball games, and just live life to the fullest. And now they've gotten this diagnosis of macular degeneration, and they're like, I'm not going to be able to drive. I'm not going to be able to read. I'm not going to be able to see my grandchildren. And what they don't realize is there are devices and there are ways that we can help them still do the things that they love and that they enjoy. And those type glasses and devices, they might look a little funny. So some of them have telescopes mounted to those. Those are called bioptics, and they will allow a patient to still drive. In Mississippi, you can drive legally with a pair of bioptics. And what we do is we make sure that your eyesight is good through those telescopes where you still can see street signs and stop signs and red lights. Doesn't mean that you have to stop living once you get this diagnosis.
Real quick, you also mentioned grandkids, which I see that you specialize in pediatric vision therapy also at Bellevue Specialty Eye Care. How soon should our kids? I know our kids get their annual sort of exam that they do, but not everybody makes it to see an eye doctor. Should you be taking your kids also to be getting their eye health checked?
Absolutely. So the American Optometric Association recommends a child's first eye exam between 6 months and 12 months of age. A huge misconception is you want to wait until a child begins school or at least until they know their letters and they can read an eye chart. And that is so far from the truth. An eye care provider can do an excellent examination on a child who is nonverbal, 6-month-old. And what they're looking for is, does that child have a significant refractive error, meaning do they need prescription to correct anything? Do they have any kind of ocular disease, like we're talking about now, that may prevent them from their vision developing normally or them learning well in a classroom? Maybe they need some adaptations. And then if everything checks out okay, about every 2 years for children, and then once they begin school, every year is what you want, because good vision, you really want that in the classroom. About 80% of the learning in the classroom is coming through the visual system. So you want to ensure that your child has great vision before they begin school. So 6 to 12 months, that's when the first eye exam should occur.
So, Dr. Lott, I feel like there's a lot of folks who need to get out and get them an eye exam from their healthcare provider. I know that's an easy one to sometimes slip through the cracks. You guys at Bellevue, especially Eye Care, you're in Hattiesburg and Jackson areas. If somebody is interested in maybe setting up an appointment at one of your clinics, how do they do that?
Yeah, they can just reach out by phone, 601-475-2020. They can visit our website, learn a little bit more about what we do. It's www.bellevuesec.com. And send us a text, too, 601-475-2020.
I like that you have 2020 in your number. I hope that was on purpose.
It's fun. It was. I had to work hard for that.
I appreciate it. I love it. And I appreciate you, Dr. Lott, for your time today here on Good Things and all your great information for eye health. Thank you.
Thank you for having me.
All righty.
Have a great week.
You guys stick with us. We got more for you coming up.